Alright, today we're going to talk about total hip replacement surgery or total hip arthroplasty. This is a procedure to treat debilitating severe arthritis in the hip joint. Patients who suffer from this will, as demonstrated by this x-ray, show severe arthritis between the ball and socket joint of the hip. The hip is essentially a ball and socket joint, and in this x-ray, cartilage is completely lost, and now the patients, when they walk, are basically walking bone on bone. Alright, so the procedure of total hip arthroplasty is essentially removing the diseased head of the thigh bone, replacing it with a metal ball and stem, and placing a metal socket into the socket of the acetabulum, which is the cup of the hip joint. Inside the metal is a piece of plastic, and now when the patient walks, there's a smooth articulation which dramatically alleviates pain and restores function. The procedure typically takes an hour and a half. The patients are in the hospital typically for 2 to 3 days, and most patients are able to go home after the procedure. There is some rehabilitation required after the surgery for a few weeks, but in general most patients are feeling quite well for 3 to 6 weeks after the procedure and are quite happy that they've proceeded with the operation.